So this is the homepage that I was describing, thinking that you could see it, but you couldn't see it. So yes, as I was mentioning, the first thing available is the quick access to the hotline numbers. Wow, my internet is really slow today. And of course, we've got them organized by region and easy access dialing by just a tap or a click. So if you're on a mobile, you don't have to open up a separate dialer to access them. Nothing fancy, but convenient. The second and most popular thing right now is the self-screening tool. And of course, there's a little disclaimer at the top to advise people that if you're coming to use this, but you're experiencing these symptoms, it means that you're having an emergency, and doing a self-screening isn't going to help you. So you should immediately get medical attention. But if you don't fall into that category and you wish to proceed, we go through the questions and give you your assessment at the end of it. So I am going to go through it. This is not my first time using self-check. I have not traveled out of Canada in the last 6 weeks. I'm not in isolation. Yes, I did come in contact with someone with a cough. Were they positive? I don't know. And I can add any information, any contact info for that person here. And then it asks me if I have any symptoms. I'll say yes. I have a cough. It started today. Do I suffer from any preconditions? Preconditions would be diseases that make, or illnesses that make you more susceptible to serious complications. No, I don't have any of those. And I'm going to get my results at the end of it. So, because of my results, it says that I should be under weekly surveillance. That is, that the health authorities should be contacting me on a weekly basis to follow up on my condition, to see if my symptoms progress to the point where they think I should be tested, and then they'll make arrangements for that. But of course, they need to be able to contact me for that information. So this is where we now ask the person to submit their contact information. Because of course, otherwise, we don't really need to contact you if you're healthy and fine. But if you do fall into this category, then you submit the information, and whatever information is collected here, it shows up on a dashboard that the persons in charge of surveillance can access. So they've got all the relevant information about your self-screening, as well as whatever other stats we could get them based on a compilation of all the self-screening results. Any questions about this?
I have data questions. So can you tell me how many self-screening tests do you guys get on average?
We have so far about 380 self-screenings done.
Right. And you can confirm that this goes already directly to the health authorities?
Yes, goes and is followed up. Like I was saying before when I was just doing audio alone, they follow it up relatively well and in a timely manner. So it's actually, I can say, something that's been working fairly well.
Right. So I already see an alignment here in terms of this. So what I really like is the fact that you guys already have essentially people that are hopefully monitoring this, right? And in our virtual assistant, right, we have essentially the same thing. Might not collect as much of this information, but what I think, given that we can be a little more penetrative in terms of getting access to people who don't have a web access. For instance, like they can call and talk to our agent, and they can also text to it. What I think, just getting into this straight away, is if we could be able to kind of, tab into yours and send you assessments that we're already getting through, let's say, an API that you can then look at.
If
That's one thing.
Sounds like something that is doable.
Yeah. So I like that already. So proceed.
Okay. All right. Well, there's this momentary. We've got around 7 minutes until our 1 hour stream time is up, and then we'll have to resume after that with a new link. FYI.
Okay. Good to know. All right. So in addition to the self-screening page, we've got a page that just gives basic information about COVID. Just for persons who might be looking for something reliable through all the noise that we get. Just keep it very, very simple. Not more than 2 sentences in any of the areas here, because people have very short attention spans. Basic symptom information, tips on prevention, again, not just keeping it as simple as possible, and frequently asked questions section, which has a bit more info, but again, generally short and easy to understand. And then we've got the statistics section the statistics that we are allowed to share, because there's more that we can share, obviously. So we've got new cases by day, by week, graphs tracking cases throughout from the first day that we had the first confirmation. So today, you've got comparisons. Yeah, we've got a lot of stuff happening here.
All right, another quick question. So does the ministry currently maintain their statistics using your platform?
They provide us with the stats, and we keep it in sync. We keep ours and theirs in sync.
Okay, so they don't essentially essentially use your platform to like register the people and update their. So like, imagine there's a patient that they create inside of the system, and then a doctor would go and say this person has switched into a critical condition, and then this automatically is updated by your app. I'm guessing the flow now is that at the end of the day they give you some information and then you guys update it.
Yeah, that's the flow currently. But like I was mentioning earlier, we do have the facilities in the app for all of that.
But they just don't want to adopt it.
But these things take time to get sorted out, unfortunately. And I gotta say this, just being open, that a lot of things could be done a lot faster, but our decision makers have some amount of apprehension with technology still, and they're generally quite slow in making decisions when it comes to adopting technology. Generally slow, especially this entire app has been an example of that. Like I said, we've been churning stuff out rapidly, like way faster than usual, but they're just fairly slow in their adoption.
So I think going into this, Alden, this is where we can provide support from our end by
you put this as one of the problems on the canvas.
Yeah, and just stack them.
This is a special problem that hopefully we can shed some light. So
I agree.
Yeah. All right. So in addition to this, that is it for public access. So persons with an account have access to this symptom tracker. So the idea was that the persons who are on surveillance, instead of having to call the healthcare worker to provide them with their information and that of their families on a daily basis. They can input the information directly within the app, and again, this information is visible and available to the persons who are in charge of surveillance. So you would fill in your information about your family, your location. Yeah, that's where I am right now. Um, you would add in information about your family members. Oops, I'm logged out.